For more than 20 years, the Breast Health Center has provided the region's most comprehensive mammography and breast health services. With 3 highly trained radiologists and a staff of registered and certified mammography radiographers, the Breast Health Center offers mammograms, ultrasound, biopsies, breast MRI, and most important, quality, compassionate breast health care.
Breast cancer is one of the leading causes of cancer among women of all ages. Especially involves women who are older, but we've seen it as young as in the 20s. Because we know that breast cancer is so significant, we also know that it's also treatable when it's at an earlier stage.
We're fortunate at Regional West that we have 3 dedicated breast radiologists. Dr. Johnson has over 30 years experience as a breast interpreter. Dr. Chetta and Dr. Young are both university trained, board certified, specializing in breast imaging as well. Between the 3 of them, we have a wonderful team here that works in collaboration with our mammographers, providing exceptional patient care. Having a mammogram is the single most effective way to find early cancer, to detect it, and to contribute to its cure, its treatment.
So screening mammography is a baseline test for all patients that they undergo. It's a basic imaging test where we look at the breast tissue. We look at it in 2 planes, and we evaluate the whole breast. If we see a subtle change as we watch breast tissue develop over the years, then we can comment on it and see if there's something that's abnormal with that breast tissue.
A lot of things on a mammogram can be dismissed if you've seen it a number of years. It's those changes that we see on a mammogram, whether it's a diagnostic or a screening, that appear to be new. Those are the ones that we usually work up with a recall. We'll have the patient come back for additional views. A lot of times that turns out to be nothing.
We know that mammography is the gold standard for screening for breast cancer. It is the best test that we have for our population, and we have the newest technology at this point. But tomography is going to add even more information.
.3D tomography is an imaging technique that utilizes a series of 1 millimeter slices that later are put together using a computer into a 3D image. The 3D tomography allows us to look into the depth of the breast. It's especially useful when breasts are extremely dense, when there's a lot of tissue that we have to look through, and there's the opportunity to miss small lesions.
We can determine if something is a summation shadow easier without necessarily having to bring patients back. We can see architectural distortions.
The benefit of the 3D is that those number of recalls where we ask the patient to come back for additional views goes down significantly.
Every woman I've ever talked to, when we call them back, that callback, they have cancer until I tell them it's not. And that's stressful. So 3D's been shown to decrease that callback rate because I can scroll through and see if something looks like it's a summation shadow. So if I get to call less ladies back, I decrease the stress that the ladies have from a callback.
Tomography is really more beneficial for those women with dense breast tissue, but it also benefits all women in general because we can catch earlier cancers with tomography than we do with regular mammograms.
We don't want to wait till they're easily visible on mammogram because that usually means that the breast cancer is more advanced.
The advantage of 3D is that we find smaller cancers at earlier stages.
1 out of every 8 women have breast cancer. So it may not affect you, but it'll affect someone in your family. And if we know that we can treat that person at an earlier stage and get them on the survival path, then we've done our job.
We have a very solid group of women that are absolutely dedicated to what they do. They connect with the patients on a personal level, and you can't get that everywhere. You can't teach that in a school. You can't learn that from reading something. That is an innate feeling, and to be able to tap into that and connect with the patients, that's what we do here that's unique.
We can complete their care all the way to either a benign diagnosis or a cancer diagnosis.
Women are very smart about what their options are, and they understand imaging of the breast more than any other imaging modality. By providing 3D here, the women of the Panhandle and region can feel confident when they come here that they'll get the very best treatment.
I would like to thank the Regional West Foundation and all of the donors that supported 3D tomography. Thank you very much.